Everybody, welcome back. And one of the things that we like to do when we have patients who call our office is to welcome them to this type of dentistry that they're not familiar with. One of the things that we find is they're not used to the concept of us trying to help them to the best of our ability. And I always tell patients, in order to figure out who you are, you're like an empty frame, and everything that we do when you come in at your visit is trying to get all these little puzzle pieces to connect them together, and then put them in the frame and figure out who you are. So when you do call, we ask you, and be aware, unless it's an emergency, we're going to have you come in for what we call our new patient examination. It's going to be a session where we get to know you, get to know your history, get to know your body, get to know your teeth, obviously, duh, dentist, and also get to know your health in general. One of the things that my training has allowed me to do is to connect the dots to let us know where you're not connected or where you are disconnected. And that will enable me then to figure out what it is that I can do to reconnect you and or reverse engineer the rabbit hole that you went down when your health wasn't going the way that it should be. So when we come in at that initial visit for your new patient examination, that's a gathering of data. It's impossible to put everything together right there and then, because it takes at least an hour and a half at least to get it all. What we do is we have you come back for a consultation. At that consultation, we go over all the dots together and share with you our findings. So don't be surprised if you're told that you'll have 2 visits before treatment starts. One to figure out what's wrong and or shed the light, and then the next one will be to show you why you've been stubbing your toe in the dark room all along. Because if you think about it, every little issue that's been put under the rug or that's been in a dark room and you haven't figured out why, those are the pieces of furniture that were in a dark room that eventually we shed light on with your radiographs, with your photographs, with our joint vibration analysis, with your body posture analysis, with your range of motion unit neck, with obviously all the other things that we do that are just dental, so to speak. And that's when we put it all together and present you, ta-da, the lit room with the now full picture frame of all the pieces that you were, and now we figure you out. Connections. God bless. Talk to you soon.